Hi everyone, welcome back. Episode 11. Happy Wednesday to all of you. We are back in the Fitz Health Conscious Corner, and tonight we are talking about cardiovascular health. And specifically, we are talking about recognizing signs and symptoms of heart attacks, stroke, cardiac arrest. So major, severe medical events or episodes that could lead to fatality. So just very, very important that we are talking about this tonight. Statistically speaking, there's a rise of cardiovascular patients in Canada, in the States. It's global. So meaning more people that are dying from heart attacks and stroke or cardiovascular diseases. And it's very, very important for us to talk about prevention, but in specific tonight to talk about recognizing those signs and symptoms, because that recognizing that can help to save a life. And you never know where in life you will be, or in a circumstance, a situation, could be at work, could be out, a social event, could be anything. And you might, need to recognize those signs and seek medical help or attempt to save someone's life. So I'm just going to give you a minute or two to settle in, and we are going to talk about cardiovascular health, and we're going to talk about recognizing those signs, those symptoms, and what you can do in those moments. How is everybody doing tonight? Good evening for some, maybe good morning for others, depending where you're tuning in. Feel free to drop in the chat where you are today. We're going to get started. Sorry. Let me just adjust this here. All right. Statistics show that everybody, almost every, in 1-to-1 ratio to 1-to-1, knows somebody or knows of someone that has had a heart attack, a stroke. Some people have been lucky to survive and tell their story, and others haven't made it to this day. And, there's some of you that right here, right now, that might relate to that. So what is a heart attack? What is a stroke? Well, in order to understand what a heart attack and what a stroke is, we need to identify what parts of the body that a heart attack affects, and that kind of says it in itself. And a stroke, what part of the body that has to do with. And so when we're talking about heart attack and we're talking about stroke, heart attack has to do with blood flow, so restricted blood flow getting into the arteries, the coronary arteries in the heart. So there's a lack of blood flow that is in the heart, and that can cause a heart attack. So meaning the heart has difficulty working and pumping blood. When we talk about a stroke has to do with limited blood flow to the brain. So there may be at times where you might see somebody that has had a heart attack or had a stroke, and maybe they were fortunate enough to get to seek medical help, and maybe in that time they were able to have a medication that or an intervention, a surgery that was able to clear the pathway of blood flow. So what happens when a heart attack happens or a stroke happens? There's an interruption in blood flow going to the heart and to the brain. Now, so to understand why it's an interruption, why it's so significant, is because we need to understand that we all have a cardiovascular system. So a cardiovascular system is a network of arteries that pumps blood around your entire body. So from your head all the way down to your toes. Okay, there's a network of arteries and it's passing oxygenated blood flow around your body. And blood flow is so important because your oxygenated blood flow is providing nutrients and minerals to major organs. So major organs such as your heart, your brain, liver, kidneys, in order for the body to thrive, it needs oxygenated blood flow. So what happens when there's an interruption in blood flow? One, a heart attack. The heart has trouble working, or the brain can either have a clot or a bleed, and it starts to, for heart and brain, it starts to damage the muscle and the good parts of the muscle, and in the brain, parts of the brain, and some parts in the brain, they can't grow back. And sometimes, if there's too much oxygen that's lost to the brain, it damages too many vessels and cells in the brain, and the brain isn't able to rejuvenate itself and make a comeback. So when there's what can happen, what happens when there's reduced blood flow? So sometimes there's a carotid artery. It's an artery in your neck, and sometimes that can build up with plaque, and it can block blood flow from getting to the brain. It can also the plaque can rupture. So that can either be in an artery going to the brain, or these can also be blockage and plaque in your heart. So in those arteries, and it's called a coronary heart disease when there's many arteries in the heart that is blocked by plaque. So that restricts blood flow. And what happens is there can be a significant event, it builds up, and in those moments, there's a decrease in blood flow to the brain and to the heart. And timing is very, very crucial in terms of being able to seek medical attention or intervention, because if too much time goes by, it means that parts of the heart and parts of the brain are basically dying. So it's not able to be repaired. So signs and symptoms. That's what we want to be able to recognize, because timing is so crucial. What we want to do is to be able to recognize those signs and symptoms so that we're able to get the appropriate help or act in the moment, make those crucial decisions to be able to give that person the best fighting chance of survival. So what are some signs and symptoms for heart attack? So for heart attack, chest pain. There can be severe chest pain, tightness, squeezing, and that pain can come and go. There's also, an individual could feel nauseous, so vomiting. They could break out into a cold sweat, shortness of breath as well. So you might, there could be also a panic, so anxiety in those moments, because the heart is just struggling to work, and oxygenated blood flow is not able to circulate. So the body starts to have these, I'm going to use this term lightly, like a malfunction, right? So if the heart if you're experiencing a heart attack, what is the best thing to do is call 911 or call your medical emergency line. Also, they do say if you have the nitroglycerin, if you have been prescribed that, has been recommended, you can take that. Sometimes aspirin is also recommended, the chewable, if the person is able to do that, because what that's doing is helping to thin the blood so that its blood flow is still able to circulate, even if it's at a reduced pace. That reduced pace could be life-saving for somebody. So Cardiac arrest is different from heart attack. Cardiac arrest is also when the heart suddenly stops working. A person might lose consciousness. So in that moment, you might be faced with a decision where CPR might be needed, so resuscitation, cardiopulmonary resuscitation, or you might need to use an AED, so an automated external defibrillator. And what that is doing, the act of both, is basically helping the heart to go back into a normal rhythm. So the AED is detecting that the heart is out of rhythm, and it tries to use the electromagnetic field to be able to try to sync the heart rhythm back into a normal rhythm. So CPR. Okay, CPR, some people are trained. It's a great idea to be trained, whether you're using it at work, whether your work requires you to do it, or just to have that knowledge. Again, life-saving. So CPR, if you're untrained, it's recommended that it's, a hard, fast push to the chest 100 to 120 times per minute. So if you're untrained, if you're trained and you're confident, it's recommended 30 chest compressions and 2 rescue breaths. And then turning, if the person is able to start to be breathing again, you're rolling them over on their side. And again, you're always calling emergencies, the first act, the first thing that you notice, you're calling for help. You're looking for someone that might be CPR trained, or you are finding an AED that you might have in your workplace, or wherever you are. You might just be out in a social gathering. Wherever it is, you're asking, you're alerting, you're bringing awareness to that situation, because timing is so crucial, everyone. I can't stress that enough. Stroke. Okay, so signs of stroke can be droopy face. So one side of the individual's face could be droopy because there's numbness. So numbness can happen either in the face, it can happen in the arm, the leg. There can be confusion. The individual can have difficulty speaking, slurred speech. Balance, so like feeling off balance and feeling like they're not able to walk. So yeah, the numbness as well. And also, so what do they say? If somebody's experiencing stroke, you're calling emergency right away, but also you're not giving them anything to eat, no medications, you're not giving them food or anything to drink, they could choke on it. You're not going to let them fall asleep, so you're going to keep them alert, and you're going to keep trying to talk to the person. You're going to even just help guiding and breathing with the person. You're going to loosen any tight clothing that the person might be wearing, so that you're helping to open up that if the body's compressed in any way. When there's compression, that can also trigger clots. So wherever that clot could be happening, any of that, the compression could trigger more clots. So you're definitely loosening tight clothing if the person is wearing any. So again, you're not letting the person sleep, right? Big thing. These are very real scenarios and situations that you could find yourself in, where someone is experiencing these signs and symptoms. I know, like, statistically in Canada, it is cardiovascular diseases are the second leading cause of death. In the States, it's the first leading cause of death. So that can be heart attack, it can be stroke, anything cardiovascular is all related to blood flow to the brain, to the heart, and to the legs. So cardiovascular diseases, it's a combined class of diseases, but it all affects blood flow, interruption of blood flow, either to the legs, to the heart, to the brain. So timing is crucial for all of these major medical events, and seeking help and finding those that are trained, or in those moments you might have to act yourself, and again using the knowledge that you have, some of the things that I've mentioned here today, is really, really just important to have. Now, remember, online, there's lots of courses that you can take just for basic knowledge at low cost. There might be some that's free just for you to be able to read and have that knowledge. So again, very, very, very important. Statistically speaking, 9 out of 10 Canadians have at least one risk factor for cardiovascular disease. So these are it's a very important topic. It's a very real, crisis that the medical field is facing, the overload of patients. So, many people are experiencing long wait times. There's people that maybe don't even make it to see, have a medical professional assess them or intervention. Again, there's things that we need to be able to learn so that we can reduce the risks or be able to manage a situation in the middle to help give that person the best fighting chance. So what about prevention? Just a couple of things just to get into quickly. And we'll expand on this a little bit more in other episodes. So just how does plaque form? Plaque can be formed by diet. So it's fatty cholesterol deposits that can block up the arteries. So diet, lack of exercise. Exercise helps to move blood flow around and keep that blood flow moving, fluid. And hydration, so being hydrated also, it helps to reduce risks of clots and to help keep blood flowing. Stress, reducing stress in your life. Stress is a big cause. They say stress is a silent killer because stress puts pressure on the vessels, on the arteries, on the nerves, everything. And like I mentioned earlier, cardiovascular system is a network of arteries all the way from the head to toes. So if there's stress on your body and it's stressing all of the arteries, it can cause these stress over time can cause narrowing and reduction in blood flow throughout the body. All right. We hear commonly more, heart attacks, and then just over time, it's like slow buildup, right? So those are a few things, right? And there's another factor, which is genetics, which is something like we really don't have much control over. Again, that's why we have to look at prevention and lifestyle to be able to really help us navigate and reduce the risks of having cardiovascular disease. So I've given you a lot today. What do you have for me? What questions do you have for me? What comments? What feedback do you have? What are you learning from this? If you didn't know and you are in Toronto or the Greater Toronto area, we're having our Misfit Club Cardiovascular Health Group is having our annual support raiser. So we're going to learn a lot more about cardiovascular health. We're going to learn in a fun way because we're also going to be playing some bingo and lots of great prizes from our community partners. So that's on November 3rd, and that is from 6:30 to 8:30. The details are on misfitclub.ca. You can get your tickets, you can donate. So it's misfitclub.ca. So lots more info. So I will be speaking there, and we're going to go in a little bit deeper on prevention, different scenarios. I'll be sharing some of my own personal experiences with having to do CPR, with having to manage someone having, a stroke multiple times actually. And, just for privacy, just keeping the names, out of the conversation, but just really, truly, having those moments, having to act fast, having to do some of these things that I've talked about tonight. So, I will get into that a little bit more in other episodes, but also in person. So if you are available, reach out, come out. It'll be a great night. So we are live right here. Episode 11, recognizing signs and symptoms of cardiovascular events such as heart attack and stroke. Any questions for me? Sending you all so much love and gratitude. Thank you all for being here. Thank you for listening. It's just, even if you're just hearing it and it's going into the mental library, you just never know where knowledge can be used. And that's why this Fitz Health Conscious Corner is here, because we're talking about all branches of life's knowledge, and we are giving each other tools and life skills, knowledge really, and insights to be able to help us navigate life in a more health conscious way. And when we're doing that, we're not just being health conscious for ourselves, we're impacting the lives of others around us. So thank you so much for being here. Thank you for impacting my life. I truly appreciate all of you. You're all so amazing. Have a wonderful week. If there's no questions or feedback, we'll close out for the night. All right. Lots of love, everybody. You all are truly, truly amazing. Have a wonderful night. Take care. Love and light, everyone. In conscious love and light. Peace out.